Good day. I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. This is the RNA series number 79. RNA is nothing but the random questions in neurology and neurosurgery with answers by Dr. Gireesh. This is to benefit the practitioners of neuroscience and the medical field for a lifelong learning and also for public awareness. What is the role of intracellular calcium in neuronal injury? This is the question that I am addressing in this series, RNA. Intracellular calcium is one of the most important second messengers in neurons. Under normal conditions, neurons maintain a very low intracellular calcium concentration, while the extracellular calcium is approximately 1 to 2 mm. This steep gradient is essential for the normal neuronal function. When the brain is injured, like stroke, traumatic brain injury, hypoxia, status epilepticus, or neurodegenerative diseases, excessive calcium enters the neurons, triggering a cascade of events known as the calcium-mediated excitotoxic cascade, which can lead to the neuronal death. Very important. The role, exactly what is the role of intracellular calcium in neuronal injury? Before that, the normal physiological role of calcium, one should understand. Calcium regulates the neurotransmitter releases, synaptic transmission, long-term potentiation, gene transcription, neuronal excitability, muscle contraction, enzyme activation, mitochondrial function. The first step in this calcium cascade after the brain injury, like in the primary brain injury following a cerebral ischemia or a traumatic brain injury or hypoxia or intracerebral hemorrhage, what occurs will be an ATP depletion. Reduced oxygen and glucose cause ATP levels to fall. Failure of sodium-potassium ATPase pump occurs, and thereby loss of ionic gradients leads to membrane depolarization, sodium accumulation, calcium influx. Massive glutamate gets released. Energy failure causes the excessive glutamate release. There will be overactivation of the glutamate receptors, especially NMDA receptors, AMPA, AMPA receptors, kinase receptors. And the calcium enters through these channels, namely the NMDA receptor channels, voltage-gated calcium channels, reverse sodium-calcium exchanger, and release from the endoplasmic reticulum, and this is the critical step in neuronal injury. And further, certain enzymes gets activated, like proteases. The calpains degrade the cytoskeleton, neurofilaments, microtubules, which result in axonal injury and neuronal degeneration. The phospholipase activation occurs. Phospholipase A2 damages the cell membranes, produces arachidonic acid, free radicals, and inflammatory mediators. Endonuclease activation occurs. DNA fragmentation occurs, which result in apoptosis. Nitric oxide synthase activation occurs, produces nitric oxide. Nitric oxide combines with the superoxide to form the peroxynitride, a highly toxic oxidant. And excessive calcium accumulates in the mitochondria. And the consequences are reduced ATP production, cytochrome release is being reduced, and you find caspase activation, apoptosis it leads to. Excessive calcium increases the superoxide, especially the reactive oxygen species like hydroxyl radicals, hydrogen peroxide, and these damage further the lipids, proteins, and the DNA. Neuroinflammation can activate the microglia to release TNF-A, IL-1B, and IL-6, and inflammation amplifies the neuronal injury. And what is the final outcome? It all depends on the severity. One can lead to necrosis, the rapid cell death in severe injury, apoptosis, a programmed cell death in surrounding tissue, synaptic dysfunction, and axonal degeneration and cognitive impairment occurs. So to simplify the cascade, the brain injury produces decreased ATP depletion, Sodium-potassium pump is affected. Failure of the membrane depolarization leads to glutamate release, leads to NMDA receptor activation, intracellular calcium ions enters, then protease and phospholipase endonucleases plus nitric oxide and reactive oxygen species get activated, and you find formation of these occurs, which lead to mitochondrial failure, DNA damage and membrane destruction, which leads to the inflammation, and finally neuronal death. This is in fact the pathogenesis of the role of intracellular calcium in neuronal injury. That's the answer for this. Thank you very much.